Well, when you're outside or you're playing with your pets, one of the things that can happen to kids is bites and stings. They definitely occur. So let's get into some details on when you can worry about it, what you can do to prevent it, and what if it happens, what should you do. Dog bites, common problem. 800,000 dog bites a year, people with dog bites seek medical care, children and adults. That means that probably way more than that occur because not everyone goes to see someone if they've had a dog bite. So it's an extremely common problem. Now, the people who get bitten the most are people who are adults that aren't so smart and are kind of wrestling around with dogs, but toddlers. Toddlers are literally eye to eye with many dogs. Their face is at the dog's face, sort of eye to eye with that mouth. And toddlers don't necessarily know what they shouldn't be doing with and without dogs, and so they may grab their ears or tug on their faces. Right. They do things that kind of irritate dogs. So sometimes dogs, even your own dog or a neighbor's dog or a dog you know very well, it's just not the moment for that little kid to be grabbing their face, and they snap. That's just a potential problem. If you don't have a dog and you've just had a baby, wait to get your dog until the child's about 4, where you can actually teach the baby about what you should and shouldn't be doing around dogs. If you do have a dog, and many people will have the dog first to see how y'all do as a couple with a pet, and then go on to have your child. If you do have a dog, it's best to have that dog neutered. Dogs that still have their hormones intact become quite territorial, very protective, and they can become sort of the alpha dog. Neuter dogs tend to do that a little bit less, so it's something to consider if you haven't neutered your dog already. And if you do have a dog, never ever leave your dog alone with your toddler or your baby, ever. I don't care how wonderful and lovely your dog is. I don't care if it's a breed that is really great with kids. Just don't leave them there. It's a completely preventable problem that can be pretty devastating, especially if it's on a toddler's face where they were bitten.
Right. I guess I would emphasize 2 points. One is go online. If you're about to get a dog and you have young children, there are dogs that are more kind of friendly toward families, and there are dogs that they say don't ever have this dog around young children. So do your homework before you get a dog. And when you do get a young puppy, and you're going to have young children, maybe you're thinking about having kids, you already have young children, get that puppy kind of used to being handled. Take its food away. Make sure that it understands that you're kind of the boss, and pull on its ears and play with it, because that's what a toddler is going to do to the dog, whether you're there or not. Whether you follow all these rules, invariably the toddler's going to be kind of all hands-on with that dog. So make sure the puppy understands this. Play with its food, play with its ears, and make sure you get a breed that's kind of user-friendly or more friendly toward families with young children. Dog. Exactly. So any dog that exhibits aggressive behavior, and there are certain breeds that you can go online and find out the ones that are a little bit more friendly, but
or
any dog,
individual dogs that just are known to not be very.
As dogs get older, they may get a little bit more cranky, but any dog that exhibits aggressive behavior is going to be much more at risk for doing injury to your child. Not only teaching your dog about how to interact with young kids and allowing himself to be pulled, but you want to teach your toddler how to interact with dogs and what to do and what not to do. So you want to teach them, we don't pull on Rover's tail, we don't pull on his ears. If a dog is eating, don't go near its food bowl, don't take its toys away, don't take its bone away. If it's got young puppies, don't approach it. So you need to teach your child the kind of do's and don'ts.
When my sister was tiny, we had a Great Dane. And she grabbed, they're called flews, the things that hang down here on the dog's face. And as a baby, she would reach up and grab them, and he'd stand up, and she would get pulled up and hanging by this poor dog's face. So that's not something your children should be doing to your dog.
And nowadays you can go online, there are books you can find that help teach your young children how to act around dogs. There's one great one called Diggity the Dog. It's a book and it's associated puppet along with it.
It's right in the book that actually can tell you.
That teaches a young toddler how to act with dogs, what to do and what not to do. If your child has been bitten though and it's broken the skin in any way, you need that child to get evaluated. Call your pediatrician, come to the emergency room. That child, definitely wash it off. You want to clean it off just as you would do with any wound, but you want to get that child evaluated because they may need to have antibiotics.
Or stitches sometimes.
Sometimes stitches too, exactly.
Yeah. Now cats also can cause trouble. They're a little different though. Dogs tend to be sort of a little bit more sort of aggressive, and they tend to bite, and cats are aloof. They're kind of renowned for being aloof, and if you leave them alone, they tend to leave you alone. They're less aggressive. They don't come at you like a dog might. However, you don't want to mess with a cat. Cats do two things that are problematic. They can scratch you, which in kids can be pretty significant. If you have a cat with long nails, long claws, they can cause some significant scratches. And cat bites are different than dog bites. They tend to get infected more often, as do cat scratches. So cats, when they do damage to the skin of a child, have a little more likelihood of getting infected, and we worry quite a bit about those. So a cat scratch or bite that goes through the skin, you should either call your pediatrician or come to the emergency department and let us take a peek at that. Cats in general, it's certain rules of thumb with any pet. Any pet with kittens or puppies, your child should stay away from. Any pet around mealtime, your child should stay away from. It's just territoriality, and it's just an area where you're increasing the risk of the child having a bite, either from a cat or a dog.
So insect bites, stings, another way your child can be injured from the environment. Talking about cats and dogs, let's focus a little bit on insect bites and stings. So any sting, any spider or bee can cause some localized pain and redness. A little cool compress on it. Generally, they're going to go away on their own with no treatment. They are painful, a little bit of acetaminophen, a little bit of ibuprofen, a little bit of cool compress to the area. There are things like calamine and Caladryl, which are kind of topical ointments that you can put on top of the wound. You want to limit, though, to the area of the bite or the sting. Now, occasionally, a child will get stung by a bee and it leaves the stinger in. You want to get the stinger out. There's two kind of good ways of doing that. One is to take a credit card and actually scrape it. And as you scrape, you kind of scrape the stinger at the same time and it comes out. The other method is to take your thumb and forefinger and kind of press the skin just below the stinger. It'll kind of pop out. You can pull it out. So either the credit card method or kind of pinching it and having the stinger pop out and pull it out that way is a great way of removing the stinger.
And you'll see that stinger. When you look at the skin where a child has had a bee ow foot, my niece's first sentence was bee ow foot. I knew she had stepped on a bee and gotten a bee sting. The stinger was there, and you'll see it. You'll see a little, it looks like a little sack and a little like a poking. You can actually see it. It's completely obvious. So you'll know when you'll need to scrape that off.
And lastly, a couple other points about bees and stings is occasionally they can be more serious. Right? And you don't even have to be allergic to the bees or stings. They can be more serious and just in a person without any type of allergy to that bee or sting. So they can occur if you've been bitten by a single insect or maybe a couple of bees get you at one time. You want to seek medical attention for a few cases. One is if there's any associated difficulty breathing. You know someone's had a bee sting or been bitten by a spider and now they've had some difficulty breathing. They need to seek medical attention immediately. That's really calling 911. If they get profound weakness or they go unconscious, again, you're going to seek medical attention by calling 911. If they develop any hives, these large kind of red blotchiness, they're itchy and red all over the body, seek medical attention. Or if on the head and neck area, the face, the lips and tongue, you see extreme swelling, again, you're going to want to seek medical attention immediately.
That's
call 911. Exactly.
Yeah. Sometimes you can take the time to drive someone to the emergency department, and sometimes you want those paramedics involved. So 911 or for any respiratory difficulty, etc.
And usually these symptoms come on fairly quickly. If someone's going to develop difficulty breathing or collapse or go unconscious, generally they come on fairly quickly after the bee sting or the sting, but you need to seek medical attention immediately.